Good afternoon. My name is Brendan Madden. I'm Professor of Cardiothoracic Medicine at St George's Hospital. I have trained at the Royal Brompton National Heart and Lung Institute and Harefield Hospital and did my MD in pulmonary hypertension with Professor Yacoub and Professor Heath in Liverpool. I've also done an MSc in applied clinical immunology and hold fellowships in the Royal Colleges of Physicians and also intensive care medicine. My main interests are in cardiothoracic intensive care, pulmonary hypertension and endobronchial intervention using rigid bronchoscopy and a variety of different techniques to address diverse large airway pathologies. I've been privileged to be associated with this excellent course for many years now. It goes from strength to strength each year, and there are excellent speakers and excellent subject cover. I find it particularly useful not just for trainees in cardiac and thoracic surgery, but also for those who are looking at getting extra training, up-to-date methodology and techniques for continuing professional development and CME points. And in this regard, it's very useful for revalidation also. During the course, my particular areas of interest are relating to thoracic trauma, and this is very helpful for me because I'm an instructor in advanced trauma life support, ATLS, for the Royal College of Surgeons in England, and also advanced life support for the Resuscitation Council. So the thoracic trauma dovetails very nicely into that. In addition, Mr. Moman and I, over the years in our clinical practice, have developed very important collaborative work trying to identify patient suitability for cardiac surgery by virtue of respiratory physiology and hemodynamics. And this is a novel area that we have been developing and progressing over the past few years, and we're using this to try to identify what patients would tolerate surgical intervention, what patients need to be optimized prior to this intervention, or indeed what patients should not have formal surgical intervention but rather pursue other treatment modalities such as transcatheter aortic valve implantation, mitral clip, or percutaneous interventions by our cardiological colleagues. And this is a very exciting area of research and development in our specialty. I have a genuine interest in teaching, and I'm an examiner in critical care and physiology for the MRCS examination of the Royal College of Surgeons, and I also enjoy teaching on the care of the critically ill surgical patient course. Each year at St George's I direct 2 cardiac advanced life support courses, and we run a very broad multidisciplinary program with our cardiothoracic, surgical and nursing colleagues. So like all the speakers on this excellent program, I'm very privileged to have a very diverse background, and that experience I hope will contribute to your enjoyment and benefit on this course, and that it is something that will help you in your practice for the future. And hopefully you will continue to maintain strong links with us.